we are looking at the cystic diseases of kidney. So we are going to focus on three main diseases, that is the medullary sponge kidney, next the multi-cystic renal dysplasia, then the simple renal cyst. So we are going to deal with all three diseases. So to start with, we are just focusing on some important points. In the medullary sponge kidney, it is sporadic in origin. It is sporadic in origin and it is characterized by medullary cyst. So there is medullary cyst which is present and it is associated with what? It is associated with hematuria and there is recurrent renal stones, and also they have a normal renal function. It is important to note. Next we are going to move on to the multi-cystic. The multi-cystic renal dysplasia. So what is meant by the multi-cystic renal dysplasia? So it is characterized by there is something known as the irregular and enlarged multi-cystic kidneys. So as the name suggests, kidneys, and it is associated with uretero-pelvic obstruction. So it has a uretero-pelvic obstruction. Then it also has the urethral genesis or the atresia. Next, what are the other things? There is the bilateral multi-cystic renal dysplasia. Bilateral multi-cystic renal dysplasia, and it is associated with the renal failure. So it has renal failure as well. Next we move on to the simple. So the simple renal cyst. So under this, that is a simple renal cyst, it is characterized by single. So there is a single or multiple. There is single or multiple renal. There is single or the multiple cyst, and this is with a normal size kidney. So there is a normal size of the kidney. And other thing to note is that there is a specific associated with microscopic hematuria. There is microscopic hematuria. So this was about a few cystic diseases of the kidney. To learn and grow daily, please do subscribe.